Things in life don't ask permission. They arrive unplanned and time slows down. This is your health, a program made for you on NTH and 5 unit station. Today we'll center our conversation on what to do before the ambulance arrives. Yes, what to do when when the person is unwell, what to do when the person is unconscious, when there is an accident, when there is an emergency. So we spoke with the health expert who taught us a lot of things concerning what to do. So it's going to be a learning and an unlearning day. My name is Uloma Ibe. You're welcome aboard. Before we join our health experts, we're going to check out the benefits of mango. Yes, let's check that together. Happy learning. Welcome back from checking out the benefits of mango. Indeed, mango is a powerhouse. You can call it the king of fruits. Yes, now you know the benefits of mango. I'm sure you'll take advantage of the benefits and ensure you eat mango whenever you have access to it. So let's now link up to our health expert who told us what to do before the ambulance arrives. Happy learning.
The case demands, if the safety of the person is not guaranteed, the first thing you need to do is to ensure that both you, who is going to be providing some response, and the person who needs help is safe. So make sure that the environment is safe and secure before you start doing anything. Now, to be sure that this person is unconscious, you have to tap on this patient, on this person. You know, tap and ask, hey, how are you? Can I help? If the person is not responding, and then you now check for breathing. Is this person breathing? Look at the chest. Does it go up and down? Then if you're not satisfied, you can now listen for the breath that is touching you. If you're sure that there's no breath and the person is not responsive, then quickly scream for help. If people are around you, ask them to call for the ambulance immediately. Those are the very first thing you have to do to make sure that, one, the environment is safe and secure, you are safe, and then two, ensure that this person is actually not responsive by tapping and asking whether the person is okay or not. If there are multiple casualties and some are screaming, please focus on the one that is not talking. The one that is shouting, help me, still has a lot of life in him or her. But that one that is not talking, that is quiet, that's the one you should pay attention to in the event of a mass casualty. Okay, now, the ambulance is like a mini hospital. Yes, it's a mobile clinic, as it were. And it's the best means of conveying a patient from point A to the hospital. Now, the beauty of an ambulance is that it provides pre-hospital care. So while the patient is being conveyed to the clinic, in the ambulance, there are paramedics who are providing care. Now, that care can make the difference between life and death. And again, in the ambulance, there's a special way of conveying a patient or somebody who is ill. Assuming there is a fracture or there's a spinal cord injury, you need to make that patient lie on a flat surface. Now, if you put that person cramped up in a car, you are going to further damage the spinal cord, the spinal cord. So the best thing is to have an ambulance convey such persons from the point of the accident to the nearest hospital so that they can get some level of care in the ambulance. Don't forget that in the ambulance you have AEDs, you have oxygen, you have splint, you have tourniquet, you have every means of stopping the bleeding and sustaining life. When you have any form of training in providing emergency response, you can be of help, at that point. And that's why we said, once you have ascertained that this patient or this person is not responsive, call for the ambulance. While the ambulance is coming, there are some basic things you can do, to keep this patient alive. One of the simplest ones we normally, recommend, and you don't have to be a healthcare practitioner. You just need to be a first responder who has basic knowledge in what we call basic life support, is to do the common CPR, where you are pumping the chest to ensure that the heart is continually pumping blood to the brain. Now, when the person is not breathing, you understand? So that means it's not taking in oxygen, and that oxygen is not getting to the brain, so there may be death coming up so shortly. So what you do is to ensure that the little oxygen that person took in before he or she stopped breathing, you are able to ensure that that oxygen is circulating in the system by pumping the heart, using the heart compression that we normally recommend. It's not something you can describe, on set like this, but the simple way is to ensure that you are pressing at the center of the chest and pressing with your bare hands. Yes, one hand on the other. If you are right-handed, let it be that your right hand is touching the chest and your left hand is on your right hand. So you're pressing maybe about 2 inches deep, and always allow the chest to come up by itself. So once you press down, allow the chest to come up. You press down again, allow the chest to come up. Do this do about 30 of such compressions. Incidentally, this is the hands-only compression where you do not breathe into the patient's or the person's nose if you're not, good at that. But if you can sustain this compression until the ambulance arrives, you are likely going to keep this person alive, just by ensuring that the blood is circulating. As you are pressing on the chest, you are doing mechanical pumping of the heart. So the heart is pushing the blood around and is getting to the brain. So you can sustain that patient or that person until an ambulance arrives. Yes, you may not be certain of the exact arrival of the ambulance, but when you call the ambulance, don't drop the phone. Don't cut the call. Ensure that you are in touch with the ambulance so that the ambulance is able to also understand the current situation. And by the time the ambulance comes, it has enough information to quickly kickstart the process and ensure that the patient is taken to the nearest healthcare facility. What normally happens is that people crowd around the scene. They deprive others who have the simple knowledge, the ability to provide help and care. And then you've seen some filming, recording. Those do not help the patient. What you should do is on the ground there, apply simple first aid. If it is bleeding, that is, because sometimes people die more from bleeding than from the injury itself. Yes. So what you can do is to actually look for a clean cloth, apply pressure on the site of the injury. Press for as hard as you can and do not remove. Even if sometimes you don't need to tie it. That's when you're doing a tourniquet. But if it's just to apply pressure on it and hold on that pressure. Even if that cloth gets soaked, don't remove it. Add another one to it. So you keep adding cloth, when the cloth gets soaked with blood, apply, but don't do this for more than 10 minutes. If you do this for about 5 minutes or 10 minutes and there's no remedy, find a way to get this patient to the nearest hospital, especially if this patient is responsive. Now, you don't have to be harassing somebody who is already down. There's no point crowding around. If you cannot help, at least, give space for those who can help. There are so many remedies that we all come up with, but they don't save lives. The ones I've just described are the ones that can actually save lives. So all the shouting, pouring water, the one I will say here and now, please do not feed anybody who is unconscious with anything. Oh, he's shouting, give me water. Don't give anybody anything. First emergency, national emergency number is the 112 number. Now, what happens when you call the 112? They patch you on to the nearest ambulance provider, which in most cases is the FCT, Emergency Medical Service and Ambulance System. However, there's a direct line to the FCT, Emergency Medical Service and Ambulance System. That's 091 5789 2931. I'll take it again. 091 5789 2931, and there's another one, 091 5789 2932. Call those numbers. You are calling directly to the people who will dispatch an ambulance quickly to the nearest center, the nearest scene rather. The idea is to always give the concise and precise location so that they can locate you very easily. And what we do, we have ambulances stationed around the FCT. So once you call, we send the nearest ambulance. At least within 10-15 minutes, an ambulance will get to you. But the ideal thing is to always give the correct location. What happens is that most persons who call are not calling from the scene. You're driving, yes, you're driving past, you see there's an accident, you call and say, oh, I saw something around Mabuchi. So the ambulance goes and is trying to locate, yes, moving around. So if you can give the exact location, and if you can remain there as a good, I don't want to use the word good Samaritan, as a good Nigerian, remain there and let's be sure that we are in contact with you so that by the time we come, we're able to locate exactly where this accident has happened. In the absence of an ambulance, you place the patient in a what we call recovery position. Lying on the side. Yes, exactly. And ensure that the airway is open. It's not, when you lie, don't the person's face, but let, be lifted up so that in case there's an obstruction of the airway, it's able to open and receive air. So always ensure that the airway is open, but lie on the side if he's breathing and is conscious, yes. Call for an ambulance. Take the person to the nearest healthcare facility because you may not know and the person does not even know what is wrong. So the earlier you get that person to the nearest healthcare facility, the better for both you and the person. So the idea is that if a patient is conscious and is able to speak to you, get as much information as possible and pass it to the healthcare provider so that as they are coming with the right information and the right equipment to be able to administer help on scene. There are so many myths about burns that are not very helpful in the long run. What happens in a burn, there's heat. So you want to cool down the temperature as much as possible. So first and foremost, let that affected part, let it pass through running water. Yeah, running water. It will bring down the temperature and avoid further spread. This is when we are talking about heat, thermal burns, not chemical burns now. We're talking about burns that are associated with heat. What you can do when you're sure that there is, some level of burn, depending on the degree of burns, any burn that you are seeing white tissue or the person is not even complaining of pain, please be very careful because it means that the nerves have been damaged already. So, but if the person is in pains, okay, that means this degree of burn is not such that the nerves have been damaged. Let running water be, allowed through that process, that part of the body, and then as much as possible, apply petroleum jelly or what we call Vaseline. Apply it on the surface. I would rather advise that we avoid the use of eggs. Sometimes we just crack egg and pour on it. What egg does is to retain the heat, but you don't want heat anymore. Yes, so egg retains the heat, on the surface, and it's also a very good source of infection because it can breed, microbes. Egg is like a medium for the growth of microorganisms once it's exposed. So you don't want egg on the surface so that you don't further introduce, microorganisms that can be harmful, especially bacteria. So expose that part of the body if you must. But if it's such that you want to also avoid exposure, use gauze, but apply it loosely so that once it can be taken off without tearing off part of the skin. However, one thing I will need to say, once a blister has been formed, don't burst that blister. Don't burst the blister. Allow the blister, to remain, because blister is also a protective mechanism that the body applies. So do not burst the blister. Let it be handled effectively by those who are trained to, treat burns. There are so many. I've mentioned egg, for instance. Pouring egg on the... And then one dangerous one is, once you see an accident or you see somebody who is involved in an accident, you quickly bundle that person. You do not know the level of damage to the spinal cord that this person has encountered. Any movement, sudden movement, can result in further damage, and at times can actually lead to death. You see, most people who are crippled or paralyzed from accident, it's not actually the accident itself that kills them. It's how you move those persons. Now, like I said, we need to begin to trust the availability of ambulance system. Where they are not, we need to strengthen the ambulance service. It's not for us to just believe that it's not there, and then we begin to do what will eventually compound the situation. Somebody who is having spinal cord injury should not be moved. Once you can secure the scene of the accident, please don't move. If you must move, drag along the axial length. That means you hold the shirt or what the person is wearing and pull backwards away. Don't pull sideways. Pull in a straight line away to safety. And then if you can place this person on a hard surface so that there's no movement of the spinal cord, that is the best way to save or secure the spinal cord of such persons. The biggest challenge we're having is spinal cord injuries, and fractures too, that become very difficult, to manage at the end of the day. The best thing is to ensure that this person is on a flat surface all the time. Whether you are sure that there's spinal cord injury or not, let this person lie face up on a flat surface.
Thank you very much to our medical experts for all of those explanations and detailed teachings on what to do before an ambulance arrives. Up next is our Did You Know segment. Let's see that together. an ambulance, you can actually revive someone back to life. An ambulance has all the medications to give the person like a first aid attention before the person arrives at the hospital. Interesting fact right there. Up next is our health tips for today. Please stay informed. Beautiful health tips for us to stay healthy. And like I told you earlier, this program, Your Health, is made for you. We want you to stay healthy, stay informed, and take care of yourself. On that note, it's a wrap on Your Health today. I want to thank our doctor for all of those teaching and explanation. And for you that joined us on the show, thank you very much. Please keep updated on the next time. My name is Uloma Idi. Please stay healthy. Remember that your health is your